Viktor Frankl, a psychiatrist and survivor of a Nazi concentration camp, once wrote, "Man is not destroyed by suffering, he is destroyed by suffering without meaning." Your patients may ask, "Am I going to die? Is there life after death? Why is this happening to me?" Can you answer them? Can you give them hope? Why should a nurse even worry about a patient's spirituality? A patient's religion or beliefs may influence medical decisions such as whether or not to take blood or use a tissue heart valve. Likewise, it may influence diet choices. It can give meaning to suffering, give patients strength to endure, and give a dying patient hope. The American Nurse Association of Code of Ethics states, "The measure nurses take for patients enable the patient to live with as much physical, emotional, social, and spiritual well-being as possible." Furthermore, the International Code of Ethics for Nurses states, "In providing care, the nurse promotes an environment in which the human rights, values, customs, and spiritual beliefs of the individual, family, and community is respected." These two code of ethics emphasize the importance of spirituality when caring for your patients. Therefore, assessing a patient's spirituality is not an option for nurses. Why do we neglect assessing a patient's spirituality? Honestly, there's not a good reason why we shouldn't. However, lack of time does play a role. I know on my floor we are caring for 6 patients and having enough time to eat lunch is a rare occasion. Likewise, not really understanding the meaning of spirituality is not always linked to religious beliefs. You need to assess what it is that gives the patient's life meaning. Fear of intruding on personal issues. The only other assessment as neglected as spirituality is sexual orientation. Furthermore, maybe it is simply outside your comfort zone to discuss. So how do we start? First, inquire about the patient's beliefs. Ask the patient what gives their life meaning. Support their beliefs whether you agree or disagree. For example, maybe a Jehovah's Witness is not taking blood, even though that could harm them. You must not have a judgmental attitude. Pray with the patient if that is what is needed. If you're unable, find someone who can. As an illustration, maybe your patient is a Buddhist. I personally am not educated in this religion. However, I would take the extra step to find someone who is. There was an example at my hospital. A woman dying of cancer had not been baptized. She was a member of Church of Christ, which believes you must be baptized in order to be saved and to go to heaven. This was very important to her, so I took the extra time to inquire into how I could help her be baptized. I do not believe the same as her. However, I knew for her sense of peace, she needed to be baptized. Provide whatever spiritual care is needed. There are many assessment tools. One of those is the FACT assessment. F. Faith or belief. What is your faith or belief? Do you consider yourself a person of faith? What do you believe gives your life meaning or purpose? A. Active. Are you active in your faith? Do you have support for your faith available to you? Do you have access to what you need to apply your faith? C. Coping. How are you coping with your medical situation? Is your faith or beliefs helping you cope? Is your faith beliefs providing comfort in light of your diagnosis? Do any of your religious beliefs or spiritual practices conflict with medical treatment? Are there any particular concerns you have for us as your medical team? The T in the FACT assessment is treatment. If the patient reports he or she is coping well and has a good support system, then encourage and reassess as needed. If not, then depending on the nurse's knowledge in the particular faith or belief, give direct support or encourage patients to reach out to their individual faith leaders. Furthermore, make a referral to a chaplain. If the situation does not have anything to do with a belief system, for example, a mother dying and leaving children behind, the fear of not being there for them on their special days, brainstorm ways to give her peace. Maybe you can ask her if she wants to record special messages for her children for those particular days. Spiritual distress. Maybe after your assessment you find your patient is in spiritual distress. They are unable to find meaning in their suffering, asking, "Why is this happening to me?" or "Why is God punishing me?" Likewise, maybe they have lost hope and cannot find peace. There was a man I cared for with lung cancer. He was able to accept the fact that he was dying. However, he was worried about his 97-year-old mother, whom he cared for. She had dementia, and he was the main caregiver. The fact of dying did not concern him. It was who would care for his mother. Moreover, there could be conflict between their belief system and what is happening. For example, someone praying and believing in miracles, yet not receiving one. The causes of spiritual distress. It can be mental illness or impending death. The impending death of a loved one. The critical illness diagnosis of a child or a loved one. Regardless of the cause, spiritual distress is as debilitating as respiratory distress. Sometimes you feel like you cannot breathe. Your heart is literally breaking. The fact of the matter is, 91% of patients believe in God. 77% believe healthcare professionals should inquire about their beliefs. 40% believe their beliefs should be inquired about more often. And only 10 to 20% report that their doctors discuss religion or spiritual beliefs. My reference page.